Hey guys, it's Dr. Kerry here. I'm very excited to be coming home back to Burlington, Ontario, Canada. I used to have a home there. I live in Florida now. And I'm going to be teaching at the Canadian Massage Convention. I got 4 classes. The first 2 classes are on the lymphatic system. And some of you may be wondering, well, why would I want to work with the lymphatic system? I don't deal with lymphedema. This is more for orthopedic patients, okay? So there's 2 classes. One is an hour long, and it's online. And so that class, you can take both really, because they're gonna be a little bit different. That class is gonna give you an overview, like what is lymphatic balancing? It's gonna get into detailed anatomy of the whole lymphatic system, what our strategies are, what techniques we use in order to get that job done. So if you don't know anything about the lymphatic system, you know, that's a good one to start with and see how it fits into the massage curriculum. The other one is lymphatic balancing specifically for the knee. So what we're going to do is take that information, but really focus on lymphatics for the knee, like how does that area particularly drain. And it's a 3-hour class and it's live. So we're going to be doing more hands-on stuff. I want to teach you some techniques. I want to teach you an application, how you would go through it, and some exercises. So why learn this? Why is this so important? So let's, we're using the knee as an example. So when you think about it, if somebody comes into your office and they have a knee dysfunction, they got pain, they could have swelling, irritation, limited range of motion, the things we typically see. So the question to ask is, how do the tissues of the knee heal? What do they need? Well, they need blood supply. So if you put your hand on your heart and you kind of make a pathway all the way down to the knee, there's a pathway. Is that blood has to go to the knee, bringing oxygen and nutrition. There's also other vital structures, right? There's the nerve flow, there's the energy flow, because I'm a doctor of oriental medicine as well as being an osteopath, so we look at different things. Now, besides that, the knee, in order for it to receive these vital structures, these vital substances, it has to get rid of the buildup of that internal waste, because if it's all swollen there's no room to get the good stuff in there, so you got to get rid of it. So this is why venous drainage and lymphatic drainage are so important. There's an old saying in osteopathy that drainage precedes supply. So that's why lymphatic balancing or drainage is so important, because once you work on that area, you want to quickly get away, those metabolic waste products so that the body can receive the oxygen and nutrition, things like that. Now, besides the inflow we talked about and the outflow, so this venous and lymphatic system, the other aspect we have to look at is tissue motion, locally at the knee and also along this pathway. So what could affect tissue motion? Protective muscle spasm, fascial tension, joint hypomobility, those different structures locally, but also along the pathway, okay? Now, ask yourself a question right now. If you had a patient who had swelling in their knee, how would you treat that? How would you get rid of the swelling? Would you massage the knee? Is that where you'd start? Would you start to get them on a bike or start having to do knee range of motion? If you did any of that, right, it wouldn't work, because the lymphatic and venous system are a low pressure system. So they have to move from a high pressure to a low pressure, okay? So the knee has to be able to drain all the way back up to the heart. So the heart has to be the area of greatest negativity. Now everybody take a deep breath in, so just breathe in. So what do you notice when you do that? Your chest expands, your diaphragm drops. What happens is, as you breathe in, your volume gets bigger. And when your volume gets bigger, your pressure decreases. So one of the things that we do in lymphatic balancing is we really want to open up this thoracic cavity. What's the #1 killer out there? It's heart disease. And a lot of my patients, when I evaluate them, they're stuck in this respiratory diaphragm, they're stuck in these ribs, okay? And because they're stuck, if you ask them to take a deep breath in, there's no excursion. Therefore, you don't get the benefit of decreasing that pressure to create a suction to get rid of that. So with lymphatic balancing, we kind of start sort of at the heart and work our way all the way down to the knee and then all the way back. Okay, so we have to look locally, but we also have to look at this pathway. And we have to kind of treat things along that way. Now we're going to show you in the specific hands-on class, the 3-hour one, we're going to show you techniques and we're going to show you the whole application so you know exactly what to do. And we're going to show you exercises as well. So again, you wouldn't exercise the knee, you'd start exercising here in the chest, you'd work over here, bring the arms up, get the ribs moving, and then work your way down towards the knee, and then from the knee back up, okay? So when we show you that, my goal is, if you understand that, then you'll be able to apply it to other areas of the body. Now, clinically, I've used a lot of my other manual therapies, and I've had patients who, let's say, have hip pain or low back pain, and they weren't responding because they still had a buildup of swelling. You could tell by your differential diagnosis, there's a buildup of swelling there. The lymph nodes were full, the leg was heavy on that side. And then once we started to drain the lymph, all of a sudden that was the difference maker. I've had it with people with shoulder problems, neck problems, concussions. So this is something you definitely want to learn. It's not the primary thing you would use. It's kind of like a supplementary exercise. You want to use your manual therapy first and then finish off with some lymphatic balancing, give them some lymphatic balancing exercises so that you can get rid of those internal toxins. You can create space for the body to heal much quicker. And if you work with orthopedic patients, you're going to benefit from this. If you work, let's say, just relaxation, you're still going to get benefit from this because you're improving, the oxygenation and flow, but also getting rid of the internal, waste products, etc. in that area. And if you work with sort of cosmetics, same thing. You're improving flow to that area. So that's the lymphatics. The other thing I'm going to be teaching is something called total body balancing. And I was originally taught that by a gentleman by the name of John Wernham. He's an osteopath from England. And when I met him, he was 99 years old and he was still treating 8 patients a day. And I remember sitting in this garden and talking with him. And he would always say I always like to interview people, the biggest mistake people make is they tend to just focus on the area of complaint. They don't sit back and take a look at the whole body, to take a look at, well, how does the body heal? Look at that inflow, that outflow, and also the tissue mobility. So let's go back to that knee example. How does the knee heal? Well, we talked about there's vital structures that have to work their way down towards the knee and then within the knee, right? And then from the knee all the way back up to the heart. So there is this pathway that has to take place. I'm using the knee as an example. It could be your lower back, it could be your shoulder, it could be your neck. It doesn't really matter. It's the same principle. So before I do local work, I want to make sure that this pathway is intact. Okay? And that's the key thing. So with this knee, I want to make sure, so when you think of this pathway, if you put your hand on the heart and you kind of draw a line all the way down to the knee, what could possibly interfere with the body's ability to heal? Well, you could have lines of fascial tension, let's say in that leg, if it's the right knee, the right leg. Think of your transverse diaphragms, your pelvic floor, your respiratory, your thoracic inlet, right? So those things could interfere with it. Why? Because these vital structures have to work their way through these things. And remember, I talked about pressure gradients. Everything has to move from a high to low pressure. So we have a thoracic cavity, we have a cranial cavity, abdominal pelvic cavity. All these cavities have different pressures. The thoracic cavity is the greatest negativity. The other thing that we look at in total body balancing is the autonomic nervous system. So why would we look at that? Well, we're always looking at healing. We're looking at the vital structures. We're looking at the blood vessels, the arteries, veins, lymphatics. If you look at the anatomy of those, it has endothelial cells, that's like skin. It has smooth muscle and it has connective tissue. The smooth muscle is under the control of the autonomic nervous system. So when you are on sympathetic overload, kind of fight or flight, you get vasoconstriction. And so a lot of times what we do in the lymphatic balancing, and also when we treat in total body balancing, we're doing it very gentle and rhythmic. We're calming down the nervous system. When we do it, we get more of a vasodilation. So in total body balancing, it's like what it says. It's more of a systemic treatment. We want to release lines of tension in the legs. We want to release lines of tension in the arms, the head and neck. We want to open up all the transverse diaphragms. We want to relax the autonomic nervous system. We do that through the gentle rhythmic motions that we do. So think about it. If you were to do all that, if you were to release lines of tension in the legs, arms, head, and neck, open up all the transverse diaphragms, calm down, modulate the autonomic nervous system, you would create a nice baseline, right? All of a sudden you create more of an opportunity for the body's physiology to take over and to begin to heal itself. That's why it's so valuable. So, in your tools, right, lymphatic balancing, definitely you want to have that. That's something you'd kind of add after your treatments. But also you want to have TBB, total body balancing, because what I found, I have a lot of practitioners locally, they'll send me some difficult patients. And these guys are good practitioners. They're great. I mean, obviously they help a lot of people, but they're more local. They work, on a knee or a back. They work where the person's complaining. And we're kind of set up for this because insurance companies, like workers' comp, in the States, Medicare, they tell you only can, doctors will sign a script, just treat this area. This is where their pain is. Instead of looking at the body from a physiological perspective. A.T. Still, who's the founding father of osteopathy, would say the rule of the artery is supreme. So osteopathy is more of a physiological model. The role of manual therapy is just to create a better environment for healing. So when we do the total body balancing, we're creating a better environment for that pathway to be restored, and the body's going to start healing. Then I would begin to do my local work, at that knee, whether it's muscle, fascia, joint, fluid, etc. I remember a patient I had years ago. He's a baseball player. He was going to college. I live in Florida now. He was going to play for the University of Florida Gators. And I think he was a lefty, and I still see him. But I remember that this was his rookie season, and he had a shoulder issue. And he went to several physical therapy clinics, and what do you think they did? They did ultrasound, they did electrical stimulation, they did ice, they did massage, they did TheraBand exercises, all sorts of different things. And he started to panic because he was still in a lot of pain. So when he came to my office, I did what we call a total body screening examination. So we look at the whole body, it takes like 4 minutes to do. And right away I said, you're a total body patient. Is anybody looking at your legs or your right arm? Is anybody looking at your transverse diaphragms? And you can see that this guy is on sympathetic overload because training camp's like a month away and he's just like all jacked up. He's all worried he's going to lose a scholarship, all these different things. So what I started to do is total body balancing. I released the lines of tension in both legs. I never touched his left shoulder. I released it in the right arm, released the head and neck, and I did in a very gentle, rhythmic way, relaxed the autonomic nervous system, and his shoulder went all the way up. And we worked with him a few more times, and he was able to go to camp. Now, anytime he's home, he comes in just for a tune-up, and he really sees the value in this work. So total body balancing is something you definitely want to learn. And I'd probably say most of my patients, I start with that. I try to create a scenario where everything is kind of balanced so that you have physiology on your side. Then you go in there and start to do the local works. Then you've got the physiology to back it all up. Okay, so that's the total body balancing, and that's going to be a 3-hour class. And I'm going to focus, explaining what is total body balancing, the fascial anatomy a bit. But we're going to get right to work. Total body balancing is 5 phases. You treat in supine, prone, side lying, left and right, and sitting. Because we only have 3 hours, we're going to focus mainly in the supine position. And the last class, you guys are keeping me busy. The last class I'm teaching is going to be, it's not really a class, it's a demonstration for like 30 minutes. And it's like quantum physics and energy balancing. So what's an osteopath, doing with all that? I asked myself that question as well. And it's interesting is that when you look at the body and it's made of energy, and you say, well, it feels pretty solid to me, I don't understand. And you start to break things down. The body is made up of systems, right? We have all different systems. Systems are made up of organs. Organs are made out of tissues. We have 4 types of tissues. You have muscles and nerves, connective tissue. Connective tissue are your arteries, veins, lymphatics. They're cartilage, it's bone, that's all connective tissue. And endothelial cells, that's your skin, the lining of your blood vessels, and also the lining of your cavities. So we have those 4 tissues. They're made up of cells. Okay? The cells are all made up of biomolecules. Biomolecules are made up of elements. So your body is primarily made up of oxygen, carbon, nitrogen. Those are the main ones that I'm thinking of. There's about 4 main ones and then a couple of other ones. So these different elements, when you look at them, they're going to break down into atoms and then subatomic particles. They're going to break down into like a nucleus and electrons around it. And if you go a little further, the nucleus is going to break down to protons and neutrons. Well, they break down even further to up quarks and down quarks. There's 3 of them on each side. So you could say that your body, right, is made up of those 4 and then a couple extra ones, elements. And those elements, right, they break all the way down to 3 structures: up quarks, down quarks, and electrons. So you could say your body is made up of those 3 things. You could take away the whole periodic table and just reduce it to 3 things. The table or the chair you're sitting on, the table, your computer's on, is all made up of those 3 things. Everything in our universe is made up of those 3 things. In quantum physics, there's something called entanglement. And entanglement's quite interesting. If you take a light source, like a wave, and you send it in 2 different directions and you observe one of them, what happens is the wave will collapse into a particle. But what's interesting is that because it's a common source and it went in 2 directions, as soon as you observe this one, it collapses, but so does this one, because they're connected. When you were born, it was a sperm and an egg, and then the egg divided into 2, then 4, 8, 16, 32. So by definition, your body is entangled. You could say, depending on your religious background, that all of us came from the same source, so we are all entangled. That's why when I teach my energy balancing class, I've got one coming up in Japan, is I can treat somebody on Zoom. I'm in Sarasota, Florida, and they're in Tokyo, and we get instantaneous changes because we're entangled. So every part of your body has to communicate with each other. Okay? Now, how did I develop this class? Well, I remember I was in Germany and I was teaching, I forget what class, and a woman came up to me and she said, can you look at my neck? In my head, I've got these problems. And I looked at it, I said, oh, you got craniosacral issues. You need to see a craniosacral therapist. And she goes, I've already done that and it's not helping. And I said, okay. I was teaching a body talk class, and body talk is where you ask the body, what's the priority? What do I need to work on? I said, well, let's check with body talk. Oh, okay, you need to balance your sphenoid with your sternocleidomastoid with your clavicle. Well, that's typically not in a protocol. And I had to do a couple of other things. And once we balanced them on her body, I didn't do energetically, I did physically. She goes, oh my God, that feels great. She goes, you got to develop a class about this. And I go, good idea. So I developed this body talk fascial balancing class. And I started to teach it to energy people who knew how to ask the body questions. And then we would say, well, what's the priority? Do I work here? Do I work there? What do I do? And then, but I taught them what I do as an osteopath. We did all the physical stuff. And I loved it. It worked really well. So it was a fun class. But then I was in North Carolina, and there was about 3 women that came up to me, and they're energy workers. And they go, I like what you're doing here, but I really feel uncomfortable touching a person's body. I don't think I'm going to touch people's body. And I go, well, do it energetically. And she goes, can you show us? And I go, okay, I never did it before. And then there was a guy in the class, and he was a chiropractor, and he had this bad hip. And he goes, and you can use my body. And we had a physical therapist from Belgium, because he knows I like to evaluate. He says, and I'll evaluate. And I go, okay. So we lied the guy down, and he had his straight leg raise was like 30 degrees. His hip flexion was maybe 80 degrees. He had no internal hip rotation. He maybe had 20 degrees external rotation. So it was pretty locked up. And I went in on the hip and I did what we call a tension test, and his left side moved, but his right side didn't. And I'm thinking, oh geez, what did I say here? So what I did is I teach this class called Mindscape, where you visually can, see, the lesion and kind of see it 3-dimensionally. So I just started to look at him, and I know, and right away what popped in my mind was bone. It wasn't the muscles, It wasn't the capsule. It wasn't nerves, arteries, veins, or an organ or anything. It was bone. And I could see it clear as day. It was the neck of the femur on that right side. So what I did is I just kind of went out and like this in the air, and I call it a hologram now. And I just started to observe it. And I'm kind of wondering what to do, but I just kind of surrendered to the experience. I just observed it. And as I observed it, I noticed it started to compress, it started to twist, and all of a sudden my hands went like that. And I go, I guess we're done. And I didn't really know what happened or what to expect, but we went and reevaluated him again. And his leg went all the way up, full range, straight leg raise, hip flexion, internal, external rotation, return. And I go, that's how you do it. And they go, bullshit, what'd you just do? And I go, I don't know. But I knew these people, and it was interesting. I go, and I went and I did the tension test again, and I go, oh my God, that is powerful. And I'm a manual therapist. I love putting my hands on people's body. And I go, there's something special here. And we stayed there till midnight that day, and we still had 2 more days. And I changed everything around. And I was teaching the same course the next week in Toronto. And I phoned the person. I said, stop the press. I've got a new manual I'm sending you. This is even better. And so since then, you know, I've had to study quantum physics. I had to understand all this and try to figure out what it is, you know, that we're doing. And we've like 3 levels now. But what I understand is like, how would this apply to you as a massage therapist? Is your patient's body is made out of energy, right? But we live in a physical world, and there's something called downward causation. And downward causation means that the physical body is on the bottom, and it is influenced by your energetic body, your energetic blueprint. It's affected by your emotions, your belief systems, your consciousness, universal consciousness. There's a trickle-down effect. The physical body is actually the least important, but it's where we spend all our time learning and working on people's body. I'm here in Phoenix, Arizona. I'm at the AMTA convention, and I was meeting a few people earlier, and this one guy, they all knew that I did energy work and things like that. And he says, can you work on this guy? And I said, sure, let's take a look at him. They've been doing lots and lots of manual stuff with this guy. And he goes, he still has this problem, he can't figure it out. And you can see that he was kind of deficient, had increased rib mobility on his right side, but this left side was just all jacked up. And you feel it, the tissues were just holding on to something. Like, what are they protecting? And so as I started to dialogue with his body, that you can see that there's a dilemma between the left and the right side of his body. There's a deficiency on one side and kind of an excess on the other side, kind of a yin-yang type thing. So what he basically had is he had a lot of anger on this side, and he had beliefs, you know, and these beliefs, you know, like I'm different, and, you know, fuck you, leave me alone, in a sense, like, you know, all these different things that were holding on. And these went back to, you know, when he was 8 years old. So we just started to work with beliefs. And remember how high beliefs are. You know, we have universal consciousness, constant beliefs. Beliefs are very powerful. Beliefs are like, what's the story you tell yourself? Right? What's your story? You know, and what's the story you've lived with most of your life? You know, something happens, whether it's good or bad, yeah, that's how things happen to me. And that's how he kind of took it. So he absorbed this. So we release, you know, your thoughts, your emotions, your beliefs is all energy as well. So we released all this, and everything just opened up. You know, back when you're born, you're with your family, you get, you know, you learn so much in those first 5 to 10 years. And, you know, you learn from your parents, brothers, sisters, friends, you know, all your experiences, you know, in school, at the playground, you know, playing sports, whatever. And what happens is all of these experiences kind of mold you, and they create your beliefs, good or bad. But what happens is you're an adult now. He's an adult now, but he's still living and running his machinery by a belief he was developed at age 8 because of interactions between his mom and his dad and things like that. So I said, we can change those beliefs. We found what they were. I go, you're an adult now, you can create. So I used to think I was different and I was angry and this and that. But now I know, you know, that as long as I'm, you know, doing things from the heart, I'm at peace. You create whatever it is, a new belief for yourself. But you got to, you got to say it again and again. So they did studies where they had people go into like a superhero pose, and they saw that their hormones would change. Guys, their testosterone would change. So I had them stand up, in a nice strong pose. It's your physiology. This stuff I learned, from Tony Robbins, and I had them, say this new belief out loud. And walking and moving is good. And the best time to say it is first thing in the morning or before you go to sleep, because you're in that theta stage. You can connect with your subconscious much easier. And I also say 3 other times during the day. And it's best to do it in front of a mirror, outside, walk, say it out loud. I got a call from him yesterday. He's doing much better, but he's got to work on this. He's got to train this over and over again. The importance of this energy work, can't be understated. And you're going to find, because of that downward causation, if your patients aren't responding to what you're doing, it's not because you're a crummy therapist. It just means you're using the wrong tool, right? And what happens is we go out and we learn all these other tools, but it's a different platform. It's energy, or it's emotions, or belief systems, consciousness. So in this demonstration, I only have a half hour. What I want to do is to take you guys through a kind of a self-energetic balancing, and kind of evaluate yourself, do it and reevaluate so you can feel it. And then I'm going to do a whole bunch of demonstrations. I'll grab somebody, hopefully we'll have a table there. I'll evaluate, I'll get maybe one of you up to evaluate, and then I'll do it. And then we'll reevaluate. You'll just see it. And the best thing to do is just see it, feel it in your own body, but then see it. Okay? All right. So I am really excited. Being a Canadian, it's fun to go back to Canada. I'm really grateful, to Scott, Monica, Amanda, and Mark for allowing me to share, my ideas with their community. So I'm really grateful. I, come back each year, and I'm really excited to share with you. And I'll see you guys in, I don't know what it is, a month from now or whatever. We'll see you then.